individuals with diabetes, the most challenging part of the treatment plan is to determine what to eat and following a meal plan. Nutrition therapy has an integral role in overall diabetes management. The objective of this discussion is to discuss the nutrition recommendation for diabetes prevention and management, to present the new approach of nutrition education in the new normal. Grains and rice and substitute, vegetables, fruits, dairy and alternatives are the sources of carbohydrates. So what is one serving of your grains or rice and substitute? 1/3 cup of rice is 1 serving. 1/3 cup of your noodles, like your bihon, sotanghon, pansit canton, then your miswa. 1/3 cup is 1 serving of your rice and substitute. 1/3 cup of your pasta, like your spaghetti and macaroni, is 1 serving of your rice and substitute. 1/2 piece of your hamburger buns is 1 serving. Then 1/2 piece of hot dog buns is 1 serving of your rice and substitute. 1/2 piece of Japanese corn is 1 serving also. Then 1 piece of your saba is 1 serving of your rice and substitute, and 1 slice of your bread is 1 serving of your rice and substitute. So what is 1 serving in terms of the starchy vegetable, legumes, and root crops? So 1/2 cup of your squash is almost 1 serving of your rice and substitute. So 1/2 cup of corn, it's 1 serving. 1/2 cup of potato, it's 1 serving. 1/2 cup of boiled kamote or sweet potato. Then 1/2 cup of your green peas or frozen peas. 1 serving of your rice and substitute. And then 1/2 cup of your red beans, it's 1 serving of your starchy and vegetables or rice, equivalent to your 1/2 serving of rice and substitute. So 1/4 of your plate must be a good source of fruit. Fruit recommendation: fructose from the natural fruit will not exceed to 12% of the total calorie requirement. So fruit must be from whole fruit over fruit juice or fruit shake. So what is 1 serving of fruit? 1 serving of melon is 1 slice. 1 serving of banana is 1 piece of banana with 6 inches length. 1 serving of apple is 1 piece of apple, like a size of a tennis ball or 1 fist of a petite woman. Then 1 serving of grapes, it's 8 pieces with seeds, but when the grape is seedless, it's 12 pieces of grapes. Then 1 serving of mango, it's 1/2 cup or 1 piece of mango. Then for lanzones, 1 serving is 7 pieces. 1 serving of orange is 1 piece, like a tennis ball size or a size of a fist of a petite woman. Then 1 serving of your durian, it's 1/3 cup seedless durian. So the next is the leafy vegetables. Quarter of the plate. It must be a good source of a leafy vegetables. What are the dietary fiber needs of people with diabetes? The regular intake of sufficient fiber is associated with lower all-cause mortality in people with diabetes. People with diabetes should consume at least the amount of fiber recommended for general population, which is a minimum of 14 grams of fiber per 1,000 kilocalories, with at least half of the grain consumption being whole intact grains. So other sources of dietary fiber includes non-starchy vegetables, avocados, fruits, and oranges, as well as pulses such as beans, peas, and lentils. Study shows that A1C reduction of 0.2% to 0.3% with intake in excess of 50 grams of fiber per day. So, what is one serving of leafy vegetables that is a good source of our fiber? So, when the vegetable is uncooked, one serving is 1 cup. Then, when the vegetable is cooked, the one serving is 1/2 cup. So, we have here the sample of one serving of your vegetables like the string beans, 1/2 cup. The cucumber, 1 cup because it's uncooked. 1 cup of cucumber, it's one serving of vegetables. Then your combination of vegetables like your salad, it's 1 cup, one serving. 1/2 cup of carrots, it's one serving of your vegetables. 1/2 cup of okra, then 1/2 cup of asparagus. 1/2 cup of broccoli, 1/2 cup of kangkong, spinach, or kamote. It's a leafy source of vegetables. One serving, then 1/2 cup of your chickpeas. It's one serving of your vegetables. So what are the fiber contents of the common foods with 1/2 cup measurement? So we have a sample here of a 1/2 cup of Japanese corn. It contains 1.6 grams of fiber. Then 1/2 cup of your string beans or Baguio beans. It contains 2.0 grams of fiber. The turnip, it's 4.8 grams of fiber. Then 1/2 cup of carrots, it's 2.0 grams of fiber. Then 1/2 cup of your sweet potato with skin, it contains 4.0 grams of fiber. And then 1/2 cup of okra, it's 4.1 grams of fiber. So the fiber content of a common fruits, nuts, and seeds. So one serving of your apple, one small size, it's 3.6 grams of fiber. One serving of your orange, it contains 2.3 grams of fiber. One serving of your durian, 1/3 cup, it's 3 grams of fiber. So 30 grams of almond, it contains 3.5 grams of fiber. And 30 grams of your peanut, it's 2.4 grams of fiber. So 1 tablespoon of chia seeds, it's 5 grams of fiber. And 1 tablespoon of flax seeds, it's 2.8 grams of fiber. And 1 tablespoon of pumpkin seeds, it's 5 grams of fiber. And then sunflower seeds, 1 tablespoon, 3.1 grams of fiber. And 1 tablespoon of your sesame seeds, it's 1.1 grams of fiber. So one part of the plate is go lean with protein. In individuals with type 2 diabetes, ingested protein can increase insulin response without increasing plasma glucose concentration. So protein is one of the 3 main energy-providing macronutrients along with carbohydrates and fats. For persons with diabetes, there is no evidence to suggest usual protein intake of 15 to 20% of the total daily energy requirement should be modified if renal function is normal. The Philippine Dietary Reference intake of protein requirement in a day of the individual based on life stages or age group from infant to adult. The meat and alternative serving size. So we have a sample here of 3 pieces of beef or 90 grams. It's 3 serving of beef. So 1 piece of this size of tilapia, it's 3 serving or 90 grams in weight. Then 1 thigh part of chicken, it's 3 serving or 90 grams edible portion. Then 1 piece of breast chicken, it's 3 servings of chicken. Then 1 slice of salmon, it's 5 servings of salmon or 150 grams in weight. What are the considerations for fat intake for people who are at risk for or have CVD and diabetes? The monounsaturated fat, it reduces in fasting glucose, triglyceride, body weight, and systolic blood pressure along with significant increase in HDL cholesterol. This is typically found in vegetable oil such as olive, peanut, avocado, and canola oil and remain liquid at room temperature. Foods high in MOPA include avocado, some fatty fish, and nuts butter. Polyunsaturated fats, the long-chain omega-3 fatty acids, the EPA and DHL, are found in fatty fish, is recommended for individuals with diabetes because of their beneficial effects on lipoproteins, prevention of heart disease. This is found in vegetable oil such as corn, safflower oil, and soybean oil. Saturated fats. The recommendation is to consume only less than 10% of the total calorie requirement in a day by replacing it with monounsaturated and polyunsaturated fatty acids. The sources of saturated fats, it's all animal fats such as those in meat, poultry, and dairy products, processed and fast food foods, palm kernel, palm oil, and coconut oil. So, increased trans fat intake did not result in changes in glucose, insulin, or triglyceride concentration, but lead to an increase in the total and LDL cholesterol and a decrease in HDL cholesterol concentration. So, in a pre-DMID study, which included close to 50% of people with diabetes, intakes of monounsaturated and polyunsaturated fat were associated with a lower risk of CVD or cardiovascular disease and death, whereas intakes of saturated fat and trans fat were associated with a higher risk of CVD. So 1 serving of milk or dairy and alternatives. For liquid milk, 1 serving is 1 cup. For the yogurt, 1 serving is 1 cup. Then for cheese, one slice, thin slice or 30 grams of cheese. Then for powdered milk, it's 4 tablespoons. For sodium recommendation, 3 milligram of sodium every day for blood pressure control. So the 2019 American Diabetes Association Standard of Medical Care recommendation is to follow the guidelines for sodium intake for the general population. So less than 2,300 milligrams per day for person with diabetes and general population. So 1,500 milligram per day for person with diabetes, hypertension, and CKD for further reduction to the individualized. So the DAS diet or dietary approach to stop hypertension, it emphasizes fruit and vegetables, low-fat dairy products, whole grains, poultry, fish and nuts, reduce insaturated fat, red meat, sweets and sugar containing beverages. So the DAS diet has been shown in large randomized controlled trial to significantly reduce blood pressure, reduce risk of diabetes, and weight loss. So, was rated also second overall and tied for best diet for diabetes in a recent report published in US News World Report. So, the sodium intake that we can acquire in some of the foods added during cooking, it's 5% added at the table, the dipping sauce, soy sauce, the shrimp sauce or patis. So 6%, 12% from the naturally occurring sodium from the vegetables or meat. Then 77% food processing. So, where does most of the sodium in our diets come from? So 1 tablespoon, we have example here, 1 tablespoon of fish sauce, it's 1,413 milligram of sodium. 1 tablespoon of your shrimp paste or bagoong, it's 1,413 milligram of sodium. 1 pack of instant noodles, 2,500 milligram of sodium. Then 1 cup of kimchi, it's 747 milligram of sodium. Then 1 tablespoon of soy sauce, it's 1,500 milligram of sodium. And 1 pack of pancit canton, it's 2,200 milligram of sodium. How about sugar? We followed the guidelines of WHO on sugar intake for adult and children. So, free sugars limit intake to less than 10% of the total calorie requirement for children and adult in a day. So, free sugars refer to all monosaccharides and disaccharides added to foods and drinks by the manufacturer, cook or consumer, including sugars natural present in honey, syrup, fruit juices, or fruit concentrate. Example of a free sugar is table sugar, golden syrup, molasses, agave syrup, rice malt syrup, coconut blossom syrup, maple syrup, coconut sugar, and honey. The sugar content of your favorite drinks for an individual adult. The sugar intake allowed in a day, it's almost 7 teaspoons. So, we have here your example of your favorite drinks, your milk tea, your Starbucks coffee, and then your regular sodas. So, for examples, your caramel Frappuccino, it's almost 66 grams of sugar content. So the healthy plate of Filipinos or the Pinggang Pinoy, we discussed earlier regarding the partition and then the food groups that we can put or place in the inside the plate, and then the portion of your food items, the healthy sources of your protein, a healthy sources of your carbohydrates from rice or grains and substitute, and then the fruits, and then the good source of your protein is from fish or chicken, and then it's either milk or water. So changes on nutrition diabetes care management during the COVID and beyond is the telenutrition now. This is the new approach in new normal in terms of nutrition education. So that telenutrition is the interactive use of electronic information and communication technologies by registered nutritionist dietitian to implement the nutrition care process and create an individualized patient meal plan. Advantages of telenutrition: improve access in nutrition care, quicker diagnosis and treatment, reaching more people with nutrition concerns, improve nutrition and health outcomes, improve quality of life, decrease travel and cost. In summary, there is no specific diabetic diet for person with diabetes. It should be a healthy meal plan and follow the dietary guidelines for general population, and to consider the food preferences, religion, culture, and economic status of individual with diabetes.